Do I keep talking?
Yeah, you keep it.
Okay, it's July 28th at 11:31, and I hereby call the meeting of the State of Texas Behavioral Health Executive Council to order. Thank you all so much for attending today. I think Daryl's going to grab an agenda, right, Daryl?
Yes, ma'am.
But in order to get the process going quickly, I'm going to postpone public comments to the end of the meeting rather than at the beginning of the meeting, because a few members need to leave early and I don't want to lose quorum or lose the advantage of everybody's input. Daryl, do I need to ask for a motion to do that?
No, ma'am. You
I
can
could
do
just
that
call
on your
for
own.
it.
Yeah.
I hope that's okay with everybody. I think we need to get this. I just saw Daryl in the back of me, the substantial issues. Otherwise, that's a little weird.
Yeah.
Is that the best we can do?
This is about it.
Okay. Do you have an agenda?
I do.
Thank you.
There you go.
Thanks. I need notes. So let's start with roll call.
Madam Chair, would you like me to call roll?
Sure, that would be great. Thank you. Hi, Sarah.
Hi, good morning.
Good morning.
Good morning.
Good.
Chair Gloria Canseco,
Present.
Sarah Abraham,
Present.
John Belamowitz,
Present.
Timothy Brown, Steve Christopherson,
Present.
Dr. Susan Fletcher,
Present.
George Francis,
He was here a second ago. There he is.
I think he's here. He's on mute.
Oh,
Energetically present off mute.
okay.
Ben Morris,
I'm here.
Jennifer Smotherman.
Here.
Madam Chair, you have a quorum.
Thank you so much. And we'd like to welcome Ben. It's a new member of the board representing, is it social work, Ben?
Yes, public members from the social worker board.
Thank you so much for joining us. We're happy to have you.
Thank you.
So let's go directly to item 4, which is the report of the executive director on a proposed plan to address 3 issues. One is revising the application and licensing process to avoid backlogs. One is addressing the current backlog of social work applications. And one is planning for a possible round of stay-at-home orders resulting from a resurgence of COVID-19, although I'm hearing the last couple of days we're starting to recover again, and I hope that trend continues. She says as she scratches her face. Daryl, do you want to change places?
No.
Okay.
I'll try to speak up. If people can't hear me, just wave or do something, and I'll try to yell even louder. At the last meeting, Chair Brown from the Social Work Board had brought up the issue of the application and licensing backlog that the Social Work Board and its applicants were experiencing over at the PLCU. We talked about the efforts that the PLCU and HHSC staff were engaged in to try and reduce and address that backlog. One of the things Chair Brown wanted to do was to be a little more proactive as well, since BHEC will be inheriting that program come September 1st. And one of the things that I was tasked with was coming up with a 3-part plan. I won't go over those points again, but Chair Canseco just laid out the plans or the points that were to be in the plan. I needed to come up with solutions with that after consultation with HHSC, the PLCU staff. Immediately after that meeting, Tim Spear and his staff and I, we did just that. We got together. We actually went over there. My staff actually went over to the PLCU. We all had a sit down and kind of brainstormed to figure out what's causing the problem. Have we ever experienced anything like this before? How was it solved then? What are we going to do now? What's going to be different under BHEC? How are we going to tackle this problem? And then also, Mr. Francis at the last meeting, I think he's the one that brought up that 3rd point in the plan about what are we going to do if we have a second round of stay-at-home orders. So we've kind of tried to address that in the plan. So long story short, I don't want to just reiterate or say what I've got written down in that draft plan, but I sent you guys the draft plan where we tried to identify all the significant problems. Now, I'm going to tell you, I'll be honest with you, there's a lot of problems that we all have. But Tim and I tried to focus on just the big ticket things, the big rocks that we're all stumbling over, that are causing the most problems. And that's what we've laid out in that plan. We also tried to come up with some practical solutions to those things, and we've tried to lay that out in the plan. Now, I did not get down super into the weeds in drafting the plan because, as I recall, this is something that y'all wanted to post on the website, and I don't want a 25-page document. I don't want to have to develop that because, number one, this is going to be a living document. Much like BHEC's transition plan, this is going to be a living document as well. It's going to have to change as we take hits or as things don't work or as they work well. We're going to have to change the plan kind of on the fly. So I don't want to get too detailed in it because it's a high altitude view, but I think I gave enough detail in it so that the public would be able to look at it and go, okay, they recognize the problem. They recognize what are the contributing factors to the problem. And here are the overall solutions that they are proposing and undertaking to try and correct the problem. So with that being said, I will answer any questions that you guys have about the draft plan. I will say this, that after Tim and I met and all the staff met, one thing we did was we visited with Chair Brown some more, and we started exploring this idea of ASWB taking over the actual vetting of applicants for approval to sit for the social work exam. I'm just going to say I like that idea. I think that's probably a pretty good idea. And what I did today is I've asked 3 members of the ASWB to come here, and I wanted them to, when we're ready, I want them to give us a little presentation today to show us what their system, their licensing portal system would look like, so that we would know what our applicants would be seeing. We would know what we would be buying into, if you will. So I'm thinking probably it might be best if we kind of have a discussion first and foremost about some of the things that I put in the plan, and I'll try to answer, Tim and I can try to answer any questions y'all have, address any concerns, and then once we get that cleared, then let's let ASWB fire up their presentation and show us. Now, I'll be candid, I told ASWB I don't want a lengthy presentation because honestly, I didn't want us all here till 6 o'clock. I didn't anticipate this meeting taking more than an hour and a half, really. So I've told them to keep it short, but I have every confidence that they'll present in such a manner that it'll give us a good idea of what we'd be getting with them. I've already been pretty impressed with just the conversations that I've had with them. So I think y'all probably will as well. But with that being said, Tim and I will stand on the floor. We'll answer any questions you have. I'll say this, I also asked Miss Alice Bradford, who's the ED for the Social Work Board. She's here with us as well today. So if I say something wrong, she can keep us on the straight and narrow and say, no, Daryl's an idiot. That's not how we do it. But she's here with us, so.
Thank you. Thank you, Daryl. I do have one question. So you mentioned the application going to the Social Worker Board first. Does that happen to with most of the boards that are involved in BHEC or represented here?
Well,
or is it different?
I'm not going to speak how it works under the PLCU. I'll let Tim talk about that. But under BHEC, how it would work if we didn't go the ASWB route, the applications would come in. They would then be directed to particular staff that are tasked with handling in the licensing division, particular staff that have been assigned for that license type. For example, licensed baccalaureate social workers. There's going to be one staff that handles those applications. LMSWs, one staff would handle those. We're going to try to parse it out so that there is one individual that is responsible really for those applications. Yeah.
Mm-hmm.
That creates continuity. It creates accountability for what happens to those applications. Now, obviously, we'll need to cross-train because if that individual is out on FMLA or is injured or just takes vacation, you need somebody that can fill in.
Sure.
But one of the things we identified over at the PLCU is the way applications are processed. they may be handled by several different people within the PLCU. That slows things down because then you have to figure out, okay, well, where are we at in it? What's been done? It also presents an opportunity for documents to become lost or missing, which that has been a problem. That's one thing that we've identified. So we want to eliminate all the hand transfer, the hand-to-hand transactions that are going on there. We want to make it a little more seamless.
Thank you. Anyone have any questions? How do we manage the questions? Do you just ask them?
Yeah, we're just talking to the council members right now. So
Okay,
if any of them, they can just unmute and speak as they
as
see
you
fit.
please. Anyone have any questions for?
I do. On the action plan number 2, either Tim or Daryl can answer. When were these 3 steps taken? And have you seen any improvement in the backlog after these 3 steps were in place?
Actually, Mr. Spear, I sent you guys some licensing information, is licensing and complaint information from the PLCU. I think it was last night or maybe night before last. If you look at that compared to what the backlog was back in our meeting in June, about a month ago, Tim and his crew have actually knocked a significant chunk out of that backlog. It was over 300 and something applications were in backlog. It's now down to, I think, 180 something. So just Tim and them throwing the extra warm bodies at it, and because they've hired, HHSC has authorized the use of temporary staff, HHSC has authorized the use of weekend overtime. Those items alone have contributed to that pretty significant reduction. Candidly, unless we want to go like the ASWB route, the solution to this is you have to throw more warm bodies at the problem, because like right now, HHSC is at 50, the PLCU is at roughly a 50% staffing level. In other words, they've only got about half the people they need to conduct operations over there. So Tim is kind of pulling some stuff out of his hat here to be able to do that significant of a reduction when he's only got half the staff that he needs to run that unit. So that's kind of a credit to him and the staff over there. But anyway, Sarah, I hope that answers your question.
Yes, thank you.
Gerald, are we set up with a full docket of staff ready to go over at BHAC? So I understand the staffing issues at PLCU as we're looking forward to a transition and people finding other jobs. How are we standing at BHAC in order to be able to take all of this on in September?
We're actually, we've got some vacancies right now, but it's nothing problematic right now. We're actually, I think, in pretty good shape. I will tell y'all, I'm not going to mention any names, but we did one individual on the enforcement side. We lost that individual on Friday. They passed away. So we're now, down when tragedy hits, it kind of hits twice. We've had some incidents like that happen that are just totally beyond anybody's control. But I think we're in pretty good shape, Jennifer. I think as far as like L&P positions, which are really what we're talking about here, I think we may have 1 or 2 that are still open, but we've got those posted, and we've got, I want to say 5 or 6 candidates that have applied for those. I know a few of those candidates. This sounds bad, but the dental board just let a bunch of people go because of the 5% budget reduction plan that they had to file. I'm not quite sure why they let them go right now, but they did nevertheless. They had a downsizing. That's actually worked to our advantage because those people who are familiar with processing out, occupational licenses, they're now coming over here and applying with us. So,
And what is an LNP again?
licensing and permit specialist, those are the staff that actually process the applications. Yeah. So.
Okay, I think that's good, and I think getting us fully staffed as quickly as possible with qualified individuals is an important part of being ready to take this on. I'm also thinking about, yes, there's a 5% cut is there any chance we would have a hiring freeze? And if so, what I know I've seen in the past, well, all of your open positions are just left open indefinitely, you know, and so getting those filled while we can still do the hiring, I think is a really good thing.
Critical. Mhm.
Yeah, you know, we were lucky. BHEC was exempted from having to prepare the 5% reduction plan like every other agency had to do.
Mhm.
They did not make us do that. Now, and I had warned y'all about extending that that happiness to the LAR process, because I don't know that we'll get that lucky when the LAR instructions come out. We almost always have to do what is called a 10% reduction plan in the LAR, which is where they make you plan for a two-step reduction of 5% and then another 5% reduction. I think that will probably be required of us. And it would not surprise me if the LBB and the legislature do mandate some sort of reduction in what we call the base revenue amount that each agency asks. In other words, when we submit our LAR to the LBB in the coming days, it would be for like $3.7 million, which is what we're appropriated each year to conduct operations. Would not surprise me if we're required to reduce that $3.7 million by 5%. You know, so just, I don't know, that's just me talking, but I'm kind of preparing myself for that whenever it comes, and then have to do a 5 and 10% reduction schedule on top of that.
Yikes.
So we'll see. The LAR instructions have not come out yet. I'm expecting them literally any day. I do expect them. I'm expecting them this week because the comptroller has given his revised estimate, revenue estimate, and I think that's what the bean counters were waiting on before they issued the LAR instructions. So I think you guys should expect that in the coming days. As soon as it hits, I'll let you know. And you know, one of the things we're going to talk about a little bit later on in this meeting is our request for exceptional items. But I think we better anticipate being included in any reductions required in the appropriations process.
And I understand that the state is going through, you know, the country is going through times of financially with regard to resources. At the same time, this council has been established in order to streamline processes, and the assumption is that costs go along with that. You know, we need to do what we can to be careful about managing costs, and we need to shoot for the revenue that we had hoped for from the get-go, and as best we can. I understand that we are limited, but we are also standing up a brand new agency with the ultimate goal of improving services and reducing costs while we reduce costs. Any other questions for Daryl on item 4A on the future backlogs? All good? Okay, 4B, the current backlog of social work applications. We've kind of talked about this before.
Yeah, we've already kind of talked about it. When Tim and I sat down, candidly, guys, the council is not in a position yet to really do much of anything about the current backlog because you have no authority about, you know, over what is going on at HHSC. You can't control the staffing issues over there or anything like that. But in talking with Tim, like I said before, HHSC, they've authorized the weekend overtime. They have authorized the use of temp employees. Now, candidly speaking, temp employees just do the same breadth and scope of work that regular FTEs can. So you're kind of limited in what you can use them for. I know one of the things that Tim has done is he has, because they're down to about 50% staffing in the PLCU, he has kind of eased restrictions on people coming back into the office and working from the office. Unfortunately, with the resurgence in COVID, though, it's a little hard to convince people. People still aren't comfortable yet coming in to the office. So, and again, unfortunately, the PLCU is geared more towards processing based on a paper-based system rather than on an electronic system. So that creates a little bit of a problem there. But I mean, if things keep going the way they're going, I mean, I think Tim and them are burning the candle at both ends. But if they can keep burning that candle at both ends, I do think this backlog will be either eliminated or reduced to a very nominal amount by the time the transition happens on September 1st. What we can account for are these unexpected things, you know, additional staff leaving, any number of things. You guys all run businesses. You know what happens. Life comes at you and dumps things on you that you just can't ever anticipate, really. So, you know.
Mr. Spinks, a question, please. Clearly, working this through a personnel exercise is not the answer. I mean, we have limited personnel. We can't bring on necessarily more personnel. So the second point would be, what are we doing to look at the process so that we can possibly change the process? If we can't change people, then can we change the process?
Yes, sir. And that's where the ASWB comes in. Now, the PLCU, when somebody applies to become a social worker, they have to sit for the national exam. But it's the board that vets those applicants to determine whether or not they are qualified to sit for that exam. That is the area, or one of the areas we have identified as a significant logjam in the processing, or in the process, the application process. And that's why Chair Brown and the staff, we've all kind of come to this conclusion that we think you guys ought to explore the use of ASWB conducting that, because then that workload that we were having to do is then shifted to ASWB, who this won't be their first rodeo, I can assure you. And I think you'll see that once they do their presentation. But that would offload a significant amount of work from staff so that we can then use those staff to address the other licensing issues, you know, handle the other application processing requirements that we have.
So so the presentation will tell us where we currently stand in revising the process and how far along we are in implementing this?
Yeah. The presentation is going to show you what they can do for us. And then it will be up to you guys, the council, to decide whether or not you want us to go forward with that as an option.
Thank you.
If there's nothing else, is there anything else? Could we go to the second round of stay-at-home orders from a resurgence on 4C?
This one is something that I don't want to say we got lucky, because we actually planned for a pandemic, but we did plan whenever we were building BHEC to have a much more remote workforce than what any of us currently have. That's why we have been moving, instead of buying servers and housing our servers in the state office building, I'm moving everything to the cloud, to the state data center. We're issuing laptops to everybody. We're not buying desktop computers. We're buying laptops. Everybody will have a VPN where they can go home, work from home. You only need to come in as you need it. That's going to be probably the biggest thing we can do to combat any kind of resurgence in COVID. Tim, did you say something?
I'm sorry, I did not.
Okay. That's going to be the biggest step we can take, is just try to maximize the use of remote working capabilities. We've been doing it here at Psychology, and it works really well. I mean, we've been doing it really well. I have visited with Ms. Ramirez, the licensing division manager, who is working very closely with Stephanie. We call her Woodsy. Her last name's escaping me now. With Woodsy over at the PLCU and Tim Spear. So they're working on the actual process. Okay, when we get applications in, how do you get it scanned in, and where do you store it so that your licensing staff who are working from home can then pull it in, pull it up, work on it, process it, attach it to Versa, and then we're off and running. They've actually got that system kind of developed, and they're ironing out the bugs in it, if you will. I talked to them the other day because I wanted to see where they were at on it. It was totally unrelated to this, but I just happened to talk to them about it. And they've actually put a lot of thought into it. So I'm feeling pretty good about the system that they've got down. And the good thing is, I guess what kind of impressed me with what they've all done is it doesn't require us to buy a fancy workflow system. They're able to do it with our cloud-based file servers and the VPNs. That's how we're doing it at Psychology. This will just be on a much bigger scale. So I think we're going to be in pretty good shape there, really, because staff have thought into this. The enforcement side is similar. I think the enforcement side is easier to do remotely, honestly, than the licensing, because you can literally come in, get you a box of complaints, go work on it, or come in, scan them, and then go home and work on them. Write up your report and either email that report to the administrative staff who are going to be rotating in and out of the office, or come in, print out your reports, and then enter it into Versa and then go home. So we've put a lot of thought into how these processes are going to work. Candidly, we had to put this much thought into it because one of the things we're finding in the hiring process is nobody wants to work in downtown Austin. It's just not as popular as it is for people with $1 million condos. It ain't popular with state employees who have to drive down here and work in this mess. So we're really trying to ramp that up so that I have that as a selling point whenever we're hiring folks, and in staff retention, because one of my big fears is we hire a bunch of people now and then they realize, well, working downtown was nice and shiny for a week, but I'm tired of it and I'm going to go work someplace else. So I need to make it so that it doesn't lose that luster, and they can stay at home and work as much as possible there.
So, Mr. Spinks, thank you for outlining all the things that we can do remotely. What are the things that we cannot do remotely that will slow the organization down?
Until we get a true online application system where people are able to upload their applications or fill out an online form, they're still going to come in the mail. Checks are still going to come in the mail. You're going to have somebody in the office to process that mail. That's the weak link in all of this. I will tell you that my staff we're already looking at. Fortunately, you guys already have an online application system. If I'm remembering right, Tim, you correct me if I'm wrong here. Do you still get most of your applications though the old-fashioned paper way through snail mail?
Yes, sir. I would say that we probably get 30 to 35% online, and the remainder is through hard copy.
So we need to, that's kind of the weak link there, is that continuing reliance upon the mail. What I would like to do, and what Ms. Nowak, our CFO, who wears many other hats that y'all don't know about, what Jenny has already started working down the road on with the database staff is, how do we get this stuff where we're not getting paper in the mail? How do we maximize the use of our database? Now, a lot of that is going to require programming changes. It might not necessarily cost us money, but the database folks are going to have to get involved. And right now, I've got them working 110% on just standing BHEC up. So I'm not going to take them off of that to work on this just yet. I think we're looking at probably the springtime before we can focus our attention heavily on shifting to true 100% online applications. When that time, once we kind of get it worked out and we figure out how we're going to do it, I want to move to mandatory online quickly. I don't want to accept paper applications anymore. I want to just require everybody upload your application into the system. That eliminates the need to have people come in, scan the mail, sort it into the different folders and whatnot. So.
So do you have a team member that's working on this vision, or somebody who's actually putting pen to paper to make this real. I mean, if you looked at the paper this morning, you notice that Google's announced that they're not bringing workers back into the office until July of next year. Apple's talking about February of next year. So these time frames that people are working remotely are getting stretched out. And so my question to you is, I agree with you. The vision is great. We should move to electronic, but what are we doing to actually make that happen? What are the tangible steps that we're taking to bring that to reality, please?
Ms. Nowak, our CFO, she is actually working with the database people, what we need to do in order to get that done. Now, is there anything on paper? No. And candidly, I don't want to take the time to try to write out a detailed plan on it right now because I'm so focused on getting this thing stood up. We're now in the home stretch before September 1st, and I need everybody's attention to ensure the database comes up and online on September 1st, and then all the renewals, people are able to renew, do all that fun stuff. I've got to make sure that that's my primary goal right now, but I can tell you that Ms. Nowak is working on that kind of in the periphery. It's just, that's going to have to wait a little bit until we can get BHEC stood up and actually functioning.
But it sounds like the platform for the process and the workflow is already under discussion. I think I walked in on that when I got
it already exists in the form that the PLCU, they have this platform, this system. It's just not being used to the same degree that we all, wish it would. Applicants are still married to printing out a paper form, filling it out, mail it in. There will come a time where we're just going to have to say no more. It has to be done this way.
So perhaps a notification on our website saying this is coming, this is planned, something to let folks know in advance that a change is on the way would be a good start as well.
I think if we're going to post this plan,
Mm-hmm.
if we're going to publish this plan, then we can put that in that plan. We can put that statement in the plan that this will be coming. Expect it sometime. It'll be sometime next year, but we're working on it. How I word it, I don't know. But
if some of that is already there in the system, if it transfers over with us in September, I think it might be helpful to have some kind of a public service announcement. I know that there's a whole lot of licensees out there who simply don't know that they can do these processes online. We know we can renew online, but in terms of the initial application and some of those initial forms, I think the idea is out there that people have to do it via paper. And so somehow letting people know, we might be able to expand that number instead of it being 30 to 35% to much more.
The target audience for that is not our licensees, though.
Okay.
We got to figure out how to get it out to basically the student population that's coming in. That's who your target audience is for that.
Okay. So that would be somehow, whether through the professional association or reaching out to some of our programs, and maybe that,
program directors.
Yeah, maybe that could be something that some of the boards take on for their program, not the board's programs, but programs that are sending applicants to those boards, maybe could help out with that in some way.
Maybe both. I think that sounds like a good idea. If there were a multi-pronged approach to notification that this is on the way, and then be prepared for it, both at the individual professional board level and at BHEC's level. A simple dialogue box saying this is coming on our website would be easy to achieve. So let's keep talking about that. Is there anything else on the COVID and how we're managing?
Yes, real quick, I want to commend you on getting the remote working taken care of, because it does feel like this is going to be going on for a little bit longer, and this is not going to be the last pandemic that we see for a while. I'm sure it's going to happen again. I have a question about the office space. I don't know the answer to this. How does the state allocate a cost to us for our offices when we get them?
They don't. We don't pay rent.
Okay. All right. That's good.
I'm glad you mentioned that, because I do want to bring up something. you know, we were just talking about those things you can't anticipate coming up. Ms. Nowak and I got an email or a phone call this week, and right now we are slated to go over to where the Public Accountancy Board is on September 1st. We actually should already be we should start moving in there at the 1st of August. The Public Accountancy Board is an SDSI agency, self-directed, semi-independent, meaning they don't get their money from the legislature. They eat what they kill. They raise their own funds and pay for their own operations. They don't get any money from the ledge. Which means when BHEC was formed, because of the size of BHEC, we wouldn't fit in the Psychology Board's facilities. So the Texas Facility Commission had to find someplace else to house us until that new office is built. They decided to kick out the Public Accountancy Board and the Architecture Board, both of which are SDSI agencies. Now, the Architecture Board is on schedule to be out, I think, at the end of this month. So I'm not worried about that. That's where the Enforcement Division will be housed. The Public Accountancy Board, on the other hand, has had a problem. Their networking gurus, I guess, or they go through AT&T for their networking, and AT&T is dragging their feet. So what I'm hearing from TFC is we may be doubling up in the Public Accountancy Board space for a little while until they can, whatever the problem is at their new office, until AT&T can kind of get on the ball and get it fixed. We're probably going to be doubling up a little bit over at the Public Accountancy Board. They're not going to be completely out. Now that brings in a whole host of new problems that nobody was really anticipating. How do you share networks, line drops, that kind of fun stuff? Security issues about, you know, data, who has access to what if you're all on the same network.
Not to mention distancing.
Yeah. Now the good thing is the Accountancy Board, like us, they're geared to work remotely. So there's only 7 to 9 of them in the office at any given time, as best we can tell. I think we'll be okay with distancing, because that space is actually, there's quite a few individual offices. So we can probably isolate them either to one side of the office or in one area and separate them from our folks. But it does present the problem of how do we handle the networking? That's we're trying to work through that now. That's not a problem that y'all can do anything about. This is just kind of an FYI. This is one of those little hiccups we've hit. It wasn't anything any of us did. It's life. I think we'll be fine, but my blood pressure will just be up for a little bit longer trying to get through this. So, but just so you know, we're working through it.
Deal.
Thank you, John.
And by the way, Mr. Blumenwitz, I just had our meeting with the Facilities Commission. I have seen the layout for the new office building. It's called the Bush Building over there about the Capitol Complex. They did I think y'all will be pleased. They did a very good job for us. I like the layout. We'll be on the 7th floor. The office will look out on UT Tower. And then it will also look out towards the Bullock Museum on what they call the mall. So we've actually got some good real estate, some good office space in that building. So it'll be actually pretty nice.
Glad to hear it. That's good.
Anything else? Are we ready to move to the presentation from ASWB? If there's no objection, then let's move on the presentation from ASWB on processing applications for examination approval through a licensing portal that they manage. And is that Robert or Alice that's going to speak to us?
No, that'll be Dave. Dave, I apologize.
Jennifer.
Your last name, I can't remember how to pronounce it.
Dave Risco, and I'm the Senior Manager in ASWB's Member Services Department. And also on the line, we have Jennifer Henkel, who is ASWB's Senior Director, and Robert Adak, who is ASWB's IT Program Manager. Before we get started,
members, ASWB is American Social Worker Board?
I'm sorry, your question was?
For the public who are watching, what does the acronym stand for?
Association of Social Work Boards.
Got it. Thanks.
We talked 2 weeks ago about ASWB's proposed solution to address your application backlog and processing challenges. And we kind of narrowed in on you using ASWB to do the pre-approval portion of that process. That's something we already do for Utah, Colorado, and Massachusetts. And before we get started with our quick presentation, I'd just like to remind you that there's no cost to this service to the Texas board or anybody other than the applicant. And ASWB has experienced staff on staff ready to go. So this process could begin fairly quickly, depending on how the programming could be accomplished. And we're thinking several months to get that going. 2 weeks ago, we were asked to come back and give you an example of what the application looks like. It's an online application, and what we're going to show you today is what we use for Colorado. This is all based on the Colorado specs, which we would do the same thing for Texas. And Robert will then show you the administrative board portal where any of your staff members, Alice, et cetera, would have access to the applications and all the documents that come to us. With that said, we're going to ask Robert to show us the application and the board portal.
Hi, good afternoon. I'm going to go ahead and first walk you guys through from the licensee standpoint, our system, very briefly showing you some of the features and functions of it. And then like Dave mentioned, we'll go ahead and send you, view it through the board portal side, where your staff would basically have access to all the applications that we're processing, assist in reviewing items that may fall outside of our scope for pre-approval, depending on the different requirements of your application. So what you're seeing right now on the screen is a social worker or an individual who's coming to ASWB's portal to begin their Colorado LSW examination. Now, our system supports multiple jurisdictions, and within a jurisdiction, we can set up multiple versions of an application based on the licensee level, as well as the type of application they're going for. Is this an initial application, an application for relicensure after expiration, licensure for renewal? The system allows us to easily configure and support those different versions out of the box. So here, once the applicant has selected the type of application they're going for, we just present them sort of their checklist of things that they need to remember as they go along through the application process. The system supports pretty much everything that you would need for a initial pre-approval, gathering attestations of education, attestations of qualifications such as legal histories or interactions with law enforcement, things of that nature. One of the features of the system is that the data is stored securely and encrypted on our systems so that without the proper access to the system, data is encrypted and not easily extractable. So for example, the social security numbers that we collect for Colorado are all highly encrypted in the database. As a matter of fact, other than the last 4 digits of the social security number, no user in the system actually has access to see a social security number. That again is a configuration of our system. If you require the last 6, the last 8, or the full visibility when you're reviewing applications, our system supports that information.
Is it actually stored physically on your system, or are you storing it in the cloud in like Azure or AWS or something like that?
So our system is hosted in Azure. It's a virtual machine. running a Windows server with a SQL database, and it's stored within there. So not only is the application level encryption there, but also access to the Azure box is limited, and access to the Azure network from outside sources is prohibited. The only way for any staff at ASWB to access this is through a double two-factor authentication process. So we have to log into a jump server with both a password and a one-time passcode. Once we've logged into there, in order to actually log into the server itself, should I have to do maintenance or deployment, there's another set of passwords and one-time passcodes that I have to enter in, further increasing the security and the access to the system. Anytime a staff member or a licensee logs into the system, we are tracking that they are logging in. Anytime a change is made to the application, whether it's a licensee or a staff member, that change is being recorded in the system so that we can have a full history of the information from the first time it's entered to its current value. So if I were to come in and add a driver's license number here, the next time I go and I change the driver's license number, that information is stored in our database, and I can recreate and say, on this date and time, this social worker logged in, changed his driver's license number from A1234 to A1235. And the same thing with the staff as well. All of their access and changes are thoroughly logged in our systems, as another way for us to ensure complete transparency and any changes to the data.
Thank you.
As the applicant goes through our system, every time they move to a new field, the actual values are being saved. So this allows to make sure that they're not 3 or 4 pages into an application and they lose internet connection and everything's lost. As I'm moving through our system is validating the answers that are being put in to make sure that they are acceptable values, and immediately saving them to the database if they are valid information. One of the beauties of this system is that it's a highly configurable system so that we can very easily add unique rules for a license or a jurisdiction. An example could be that for your highest level of license, you do not want anybody who's under the age of 16 to apply. Our system can easily enforce that. But on your lowest level, you could say anybody above the age of 15 can apply. That is a simple rule within our system. It's a very flexible way to configure the system and allow us to easily deploy changes that you may have to your application process to meet changes in the business environment. As they go through the application, they'll get to their payment. For security purposes and PCI compliance, we do not store any credit card information. That's handled 100% in a PCI compliant manner with our payment provider, Authorized.net. We render a form from Authorized.net. They put their credit card information in, and all we receive is the approval or denial of that payment, and then we record that in our system. Throughout the application process, the applicant has the ability to step away and come back to the system through their what we call our social worker dashboard. This gives them the ability to track the status of their application throughout the process. Here we see this individual has not yet submitted their application. They could also see that the application has been submitted, it's under review with us, and whether or not they've been approved to take the ASWB examination. I'll go ahead and switch over to the board portal if there's no questions from the applicant side or pertaining to the applicant side of the process. All right.
Robert, this is Daryl. One quick question on if an applicant runs into a problem, I see there's a help button up there. What type of, I guess, customer support do you provide?
A great question. So currently, we offer email support because of the work at home. We are in the next 3 months or so, we'll be implementing live chat capabilities in some of our other parts of the system. We're looking to possibly introduce that as well. There is also the ability for frequently asked questions sections, so that if they're on a particular page, we can, and we know that certain questions or certain requests may cause confusion, we can deliver context appropriate help to them at that point.
What's your service level agreement in terms of if someone has a question and you're responding by email, please?
Dave and Jennifer can talk better to that point. Dave?
I'm having trouble hearing. I didn't hear what George asked.
What is your service level agreement, please? If someone has a question and you're responding by email, how quickly will you respond?
Before we switched over to all email access, we answered the phone from 8 in the morning until 5 at night, and there was no backlog in any phone calls. Since we start working remotely, we get hundreds of emails a day, and those take a little bit longer to answer. Usually 24 hours, people get a response.
What are your outliers? Up to what point does it take?
Up to what point?
Meaning, is your longest wait time a week, 2 weeks? On average, it's 24 hours, but what's your outlier on that?
Like, what's the worst case?
Worst case in answering in an email, normally 2 days.
Thank you.
Yes, sir. This is Ben Morris. I have a couple of questions, please. So y'all will be receiving the application fees. ASWB is being paid for this service as a for-profit institution. Is that correct?
ASWB is a nonprofit organization, and yes, we do make profit on these services that we offer. But the fee that we charge is $60, and that includes all overhead, all programming, and all payroll. So as you can see, it's not too profitable for ASWB. We do it as a service to member boards.
Okay, thank you for that. And I'm just going to ask this question. Are those fees, is that money shared with any other board or council in the government?
No.
Okay. All right. And another quick question, please, is right now y'all are servicing 3 states and working to acquire Texas. Is that correct?
Correct. And others.
And others. Okay. And let's suppose that this just works great and you have a windfall of new customers, new states. So what I'm concerned with is that the need can outgrow the personnel. And what I want to see this to work, but I don't want Texas to be kicking the can down the road, so to speak. So we get into it and then y'all get hit by COVID the same way and y'all have to lose personnel. What assurances do we have that y'all will take that into consideration?
ASWB is committed to full service, and that includes providing the appropriate staff to service all the states that we get. We have implemented working remotely, which works surprisingly well for most of our staff. There are certain things that need to be done in person, like picking mail up and processing transcripts, those type things. We do have a skeleton staff in the office to handle those items. And ASWB leadership is fully committed to providing the services that are needed to complete the service.
And Ben, this is Jennifer. Nice to see you. Remember me from new board member training? Good to see your face.
I do. Washington, D.C., great trip.
That's right. That's right. I will also say, because ASWB is a private not-for-profit, we can be a lot more nimble than some of the state departments and organizations. We can hire temps if we need to. We can hire staff immediately. We don't have to go through a process to expand our budget to get new staff in line. We're just flexible enough that we can hire as the need dictates. So we have a lot more flexibility being a private non-for-profit than some of the larger organizations, and especially the state organizations.
Are you saying that the state organizations can sometimes get bogged down in politics?
No, I would never say that. Never.
Hey, just talking to you. Thank you.
Thank you. Any more questions? Do you want to continue? Was it Dave speaking? No.
Robert, so yeah, let me go ahead and we'll switch over to the board portal side. This is basically when our staff may need additional input from the Texas staff for processing applications. In the case of Colorado, this is sometimes needed for responses to what Colorado calls its qualifying questions. These basically pertain with prior convictions, outstanding legal issues, things of this nature. Colorado, in our setup, reserves a right to approve or deny the applications in those particular examples. So when the Texas staff logs in, they have access to a red light, green light sort of dashboard. Red indicates these are applications that ASWB is currently awaiting feedback from the Texas board on in order to proceed with the processing of the application. You also have access to all the applications that have been submitted and processed by ASWB, regardless of their current status. So here, as the Colorado board member that I am logged in as, I currently can see that there's 961 applications that have been closed in the last year by ASWB, and I can search those. There are currently 650 applications that are currently waiting for where we have told the applicant that they have been approved to take the ASWB examination, and we're waiting for them to report their exam, to take their exam. And then there's 69 applications in which the applicant has submitted it to us, and we are waiting for additional information in various parts. So as a board member, anytime we indicate that review is necessary on an application, our system will automatically generate an email to let you know that a new application review is necessary. It'll provide you with, by default, basic information of the applicant's name, the date it was sent to your organization for review. When you log in, you can come to the View Application section to see the list of all of the applications that are needing attention. And I'm currently running this on our development server, so the information contained in here is fictitious names and some other implemented data for, of course, security purposes. So here we can take a look. We see one application for a Casey Donahoe, and we can go in and we can view the application. So here we have information about what's going on. It's a threaded conversation, so you can see that there's a response from our staff, a response from a member of the Colorado board, and then another response here. You will be able to expand and see all of the responses inputted by the applicant through the application. Again, you'll notice here that the Social Security number is masked by default. The only information that's transferred off of our server is actually the 6789 part of it. Unlike some other systems where they may transfer the whole information and say, only show the last 4 digits, we make sure that we only transmit the last 4 digits. So you can go through the various parts of your application. In this case, Colorado has it broken down into 6 parts. The qualifying questionnaire is the one that I spoke to before, where these are generally the ones that we are forwarding to the Colorado board for their review. They're basically broken up into 2 parts, a yes/no question, and then if they answered yes, they're asked to provide additional information. Excuse me. Any information that the applicant uploaded as part of their application is available for you to view and to download. And again, because you've accessed this system or accessed this application, our system has tracked that I've accessed it at 1:31 local time here. So again, we have security and visibility into making sure that we know who's accessing a system at what particular point. Excuse me. You're able to basically just render your decision. So your staff has gone through and said, yep, this is fine. And you'll submit your information and return it to ASWB. Now what will happen is on our side, our system will send an email to our team saying, the board has rendered a decision. Please go in and review this application for the next step. A member of Dave's team would then log into our local desktop application, access that application, and take the appropriate actions necessary.
Robert,
yes.
Can you go back to that entry for a second, please?
Yep. Let me pull up a different one. Once that one's gone, I'll need to just find another one to pull up. Bear with me.
While we're waiting for you to do that, if you notice, so you masked the first few digits of Social Security. If there was anything else that we wanted to mask, say the driver's license, a couple of digits there, any of that is custom. We can make those requests.
It is. It's configurable in our system, and being the IT kind of person that I am, there's a big difference to call out between customization and configuration. So customization means that we have to go in, develop code, test that code in order to deploy that that feature. Configuration, our system already supports that. So any field in here, I can go in and say, only show me the last 4 characters.
Right. That's what I was getting at. I'm not a techie. Thank you.
Let me just try and find one here that we can go in. And again, you're able to search only the applications that are for your jurisdiction. There's no way for staff to see other jurisdictions' information.
How many entries do you have in this test database that you're showing us, Robert?
I'm sorry?
How many data entries do you have in this test database that you're showing us?
There's just over 1,200 at this point in the system.
I'm noticing a little bit of lag in your system. Is that typical to expect or atypical?
So there is a short delay in the system while it's accessing and pulling up the information. This is our test server, so it is running at a slightly slower configuration than our production system. So these delays are exaggerated a little bit. Normally, to render a search and pull up an information, it's generally under 2 seconds to 3 seconds, comparable with most online systems.
What's the largest number of entries that you have for one of your customers currently?
In this system would be the Colorado with the around overall in Colorado, there's over 2,000 applications right now, 1,000 of which have actually been submitted to us and are in various states of review or approval by us.
How many users can hit your system simultaneously without seeing any degradation of time?
Our system is load tested right now to support up to 150 external users and 125 internal users all at the same time. However, the system is sized to support many more simultaneous connections than that.
So that 150 is across all your customer base and not a single customer such as Colorado.
That's correct. And we're talking logged in at the same point of time, which at any given point right now, we generally see at most 10 to 20 people logged into the application side of things. As part of this ASWB central system, however, we also support the sales of our individual practice tests, as well as our online or our guides and score transfers. At any given point, overall within the system, we generally see about at maximum times, which is right around lunchtime every day or around around 5 o'clock, we can see a maximum connection load to the server of upwards of 300 individuals with no performance degradation at all.
And you were going to find another user for me so we can go back. I was curious for you to bring up an image, please.
Yep, so here's one. So is there something specific that you wanted to?
Yes, on the previous one, I thought you clicked on image and the image did not appear. So I was curious to see what that image would look like, such as their transcripts or whatever documentation they may submit.
Right. So for our test system, again, for security purposes, we've moved some of the data from the production system in order to seed it, but we've changed names, social security numbers, date of birth. Items like transcripts and such, we don't move over into the system, again, for security. But basically, all you would do is click on the view, and depending on how your browser handles that particular file, it will render it on the system. So
go ahead, please. I'm sorry.
I was going to say, so in the case of my system for PDFs, for example, when I click on view a PDF, it will open it up in my browser. If my system doesn't support that particular file extension, it will download it to my local PC, just like you would if you're trying to access any other file through your browser.
So what are you doing to compress the images to make sure that for our users, they come up very rapidly and they're not sitting there waiting for an image to appear? Are you using customized compressions? Are you using standard off-the-shelf compressions? What are you doing?
So great question. So for the most part, we're using just standard off-the-shelf methods of transferring the files locally. One, it's just easier to maintain when you use what's publicly available and built in to the underlying code. In this case, our application's all based on C#, so it's a normal HTTPS transfer and standard compression. We are looking at other ways of creating bundles, if you will, so that this way you can download all the application files together at one rather than have to upload each individual file that's attached to that application. And that's something we're expecting to have by the end of this year.
Thank you.
So some other items within the system, depending on what the needs are of the board, we have built-in reporting. So here you can get a snapshot of what's occurred in the last month, last 30 days, 90 days, year to date. And all of this information would be exportable to PDF, exportable to Excel for you to use if you wanted. And again, we have full control in being able to configure what information you want shown and exported to the file for your reporting purposes. The other enhancements or other features of our system is once that our staff has approved an application for examination, That information is immediately sent over to our in-house registration system so that it's immediately the processing occurs more rapidly than what you may experience today, where you're going to our site, uploading the information, and periodically through the day, we're pulling in those approvals to process. When used through our system, those approvals are immediately available in the ASWB system for our intake purposes. The applicants would then receive a notification, one from the application side indicating that their application has now been approved for examination. And then once the approval has been set into our registration system, they'll get another email saying that they can now log in and register for the ASWB exam, as well as provide them with additional information for the examination purposes. So that sort of concludes the board portal side and the applicant side of things. Are there any other questions that I can offer an answer to for anybody?
No other questions? I think that we're okay then.
Chair, I apologize. I was on mute. I was asking Robert, one of the things that we often get asked about is in terms of reporting. Can you show us what reporting capabilities this has so we know how long it's taking us to process things, how many files we have at any given time, and WIP in the work in process? What can this system do for us in terms of reporting?
So that's a great question. By default, it really would be what you would like to have available to you. So Colorado has a very basic requirement where they select just a generic date range, and we provide them the number of the total number in 3 buckets. We break it down by the licensee type. They can export that all to Excel, where they can then massage it. What data elements we include in that export is configurable in our system. Here, it's just the straight data that you're seeing on the screen. We can calculate based on business days, Monday through Friday during our working hours, excluding, federal holidays if needed. We can report that in days or total hours. We do have for Massachusetts a weekly report that we send out to them, which includes the total number of applications that we've worked for that week, what the oldest applications are by the license type and by the application type, what the average items are. And one of the things that we're also able to do in this system is accurately reflect the SLA or the MTTR for that application. And what I mean by that is that in Colorado's case, after the applicant submits the application to us, there's certain information that we require in order to continue processing. Copies of the transcripts, it may be a legalized or notarized form that they may need to mail to us depending on the type of application or what's going on. Our system is able to track that that is a non-ASWB, non-board time, and remove that from the overall calculation, so that if you see an application, for example, if we use our first one on this line here, it shows that the applicant submitted to the initial application to us October 23rd, and it wasn't approved for examination until December 2nd. We're actually able to also include on the reporting that of that, 32 days was us waiting for the information from the applicant. We can also include in there how, if it went to the board, how long it took the board to respond to the request that we sent over, so that any point in that application, we have a fair representation of the ownership time of an application from the day it was born to the day it's closed.
Can you also do that by users? So for example, if Executive Director Spinks wanted to have a coaching opportunity with an employee based upon the speed of time at which it takes them to process an application, he would have the data to support his statements to show the employee so they could understand where they might have a slowdown.
Yes, like I said, it all goes back to everything that's being done in the system is being logged and cataloged, so that at any point we can deliver a report that says for this particular user, it takes them X number of days or X number of hours every time they open an application before they move on to the next application, and the various points in between that.
Okay. Is there any artificial intelligence built in, such as when an applicant is submitting their application, but maybe they did not attach a transcript like they should? Is the program smart enough to recognize that transcript's not there and proactively send them an email and say, hey, you forgot to submit this, can you please turn it in?
So great question. There is not anything from a artificial intelligence standpoint. However, the configuration of the system handles that in two parts. One, at any point during that application, we have the ability to require a file be uploaded or require a specific item be answered, or a specific time frame passed from a date that they've entered before they can proceed through the application. And then once it's submitted, we do have the capability of sending those tickler emails to say, hey, you've submitted your application, it's been 30 days, and we're still waiting for the transcripts, or we're still waiting for this notification form. Those are all configuration items within the system that we currently support, and we would just need to work with your team to outline and determine what those different items should be.
By the same token, can it alert our staff when an applicant submits new information and let the staff know, hey, there's an alert, you have new information based on this applicant?
So again, great question. So that's one of the built-in functionalities of our system is that when I open up and start a application that was just submitted, it's assigned to me. So anytime the status of that application changes and there's new information added, I can receive a notification to let me know that there's been an update to that application that was performed by somebody other than myself. So exactly in your case, if the applicant logs back in and adds new information there, I can receive a notification straight away. And that's one of the beauties about our system over a paper-based system is that as we are ASWB are going through the application, if information is incorrect or not thorough enough, we are responding back to the applicant via email, letting them know what the problems are, and the applicant is then able to log back into the system, correct those deficiencies, and return it back to us. So there's not a delay in having to send them an email or send them a letter outlining what the issues are. Hopefully it gets delivered in a timely fashion or at all. And then for them to mail that information back, it's all easily handled within the system itself.
I have a question about the, sorry, George, funny face. I have a question about that. So I work often with a similar database for private foundation grant applications, and often it simply won't let me proceed until a particular document is uploaded, or if something is filled out incorrectly or something like that. I'm assuming that something as sophisticated like that has that configured and in place?
That's correct. Our system allows us any data element that you're requesting through the application process. We can put different validation rules on it to say they cannot proceed until this box is checked, or this particular file, an upload has occurred, or this particular date has been satisfied. Those are all the different configurations. And once we have your application, we've determined the start and end of where that pre-approval is based on your application. We'll work with your team to implement what those validation rules and allowed go forward steps are.
Thank you. Sorry, George.
No problem. One last question, please. You started and you mentioned that this was roughly $60 per application we submitted. What's the next price point in the price break at how many applications, please?
Dave, did
Price
you want to
point?
answer that?
Yes, the price point in the next step in the application, meaning the more work we do.
Correct. If we do 100 applications, it's $60 an application. If I give you 500 applications, what's the price point at that point?
No, it's all $60 regardless.
If I give you 10,000 applications, you're telling me it's still $60?
Well, I think we'd have to talk about that. 'Cause we still have payroll to meet and overhead, et cetera.
But I would be surprised that you're not able to achieve economies of scale by getting so many more applications and automating it.
But we don't pay for it, George. It's paid for by the applicant. And we're not going to have 10,000 social workers applying at any one time.
No, the number was an exaggeration. The point still being the same, though, that with the economies of scale, we should be able to drive the price point down. Even if the applicants are paying for it, we should be able to get the best price possible for our customers.
Well, I think with ASWB, they've determined what is reasonable for them to charge. They're not making a huge amount of money on this, and $60 the cost per unit, and I don't think there's any discount.
And frankly, in terms of margins, nonprofits are businesses. The margin that they've chosen is, you know, their program fees. They still have to pay their workforce, their overhead. You know, they're just not as hyper regulated as a government agency.
Mr. Spinks, I wouldn't expect you to answer this in open forum, but if you could please get to us at a later point, what is our cost for processing an application? I would be interested to compare their charge against what it's costing us internally to see what the benefits and disadvantages are, please.
Okay, I'll see if I can parse that out and get that out to y'all.
Thank you, sir. Thank you, ma'am.
Thank you, George. Those are insightful questions. We're glad to have someone with your expertise.
Dave, this is Daryl. Is there any in the fee, like what we're talking about doing is just handing off the vetting of applicants for example? Is there any change in the fee if a board hands off the entirety of the application processing to you?
Yes, there are different points where the price would change depending on the service that we provide based on your specs. For example, if we're gathering references, professional references, or supervisory references, depending on the detail of review that would be required and the documents that we would need to collect, the price would change on that. For example, just references and a simple supervision form would add about $25 to the price, bring it up to about $85. If we process licenses to the point of licensure apps up to the point of issuing a license number, then the board would be looking at a fee of about $100.
Thank you.
Are there any other questions or comments in this regard for the ASWB presentation? Then I'd like to proceed, if it's all right with everyone, to item 6, discussion regarding exceptional items to be included in the 22-23 legislative appropriations request. Can you talk about
Sure.
that, Darrell?
And Madam Chair, I'll need some direction from the council about how it would like me to, if it wants me to proceed right now, or if we want to wait until I gather that information that Mr. Francis has requested. I just kind of need to know what my marching orders are after this meeting with regard to exploring the ASWB option.
The cost.
I definitely say proceed because we've got a backlog and they can help out. So I'm 100% in.
Anybody else?
What's the contract period we would sign up for, Mr. Spinks, with this? What's the duration of it? What is our commitment? What is our portion of that contract?
I haven't actually even seen Mr. Francis, because I didn't want to get that far yet until I knew how y'all felt about it. Dave, can you talk to us about the contract term?
Dave, I think you're muted.
Jennifer, can you talk to us about the contract term?
I'm getting ahead of myself there. I'm sorry. I muted. For example, Massachusetts, we charge differently than we do in Utah and Colorado.
I'm not sure what that means, sir.
Why would that be?
Can you explain why, same question, why that is, how it's relevant? I'm not sure I understand.
I'm having a problem here listening and.
Right. Is there someone else on your team that could respond?
Yeah, let me speak to the contract pieces. So we have, through Massachusetts, we did an RFP process, and that contract is directly with the state in terms of that, and that's a fee remittance to Massachusetts, so that's a different process. But Daryl, in terms of the contract, we could do a 1-year contract, we could do a 3-year, 5-year. I mean, we would definitely let the attorneys figure that out, but we could certainly, if there's some concerns about the process, you know, we could have a renewal period so you could assess how it's working out for you and for the applicants in Texas. So we would not, certainly we wouldn't put you into a 10-year bind or any sort of long-term contract like that. So we are flexible in terms of the board's needs, but no less than a 1-year contract, obviously, if we're going to go through the programming and set up the system.
Okay, I think I can hear and speak a little bit better. Utah and Colorado, we have a memo of understanding that is 3 years, automatically renewable. Massachusetts is a contract that we have for 9 years, and it's renewable every 3 years. And Massachusetts has renewed with us since 2005. And Colorado and Utah are on the automatic renewal portion, so it's just done a little bit differently. We collect money for Massachusetts and we remit licensure fees to them, so that's done a little bit differently. Colorado and Utah, we collect the fee and we retain 100% of that fee and remit nothing to them. That's why it's set up differently. So the contract with Texas would be the MOU, the Memo of Understanding. 1 year is probably kind of short for the programming that would need to be done. So we would end up requesting at least a 3-year setup for the pre-approval portion.
How much time do you typically take setting it up? So we're interested in, when does it start working? For the end.
It would take 2 to 3 months after we get your specs and get the Memo of Understanding signed. So I don't think it'd be possible to get it set up by your September 1st guideline, but not far from there, probably October, and Robert probably can give us a better idea as to the timeline.
Candidly, it would probably take longer than that, guys, because it may require, we may have to do some rule changes. So that might lengthen it out.
So perhaps we could form a committee to deal with this. The board is acceptable. I mean, unless this is, Daryl, you tell me, is this uniquely a function of or should a board look at that with you? What do you suggest? How do you think we can move this along? Sorry, I turned around. I forgot.
I mean, we can do it at the council.
Faster, or would it slow you down?
I don't need the committee. That would probably slow me down. Mm-hmm. But at the same time, it's not gonna slow me down or hurt my feelings if you, obviously anything I do, I have to bring back to y'all,
of course,
before I can sign off on it. So we're not talking about I would sign up to something that y'all had never seen before. I would have to bring it back to the council meeting. You have to approve it.
I feel like we have different levels of expertise that I don't want to miss out on. Poor George. But even from user perspective, since I do this on a daily basis and maybe certain other board members do as well, I mean, council members, excuse me, do that as well, maybe it's something that we do want to just eyeball because we're looking at it from different perspectives. George, you're obviously looking at it on an executive level and as this is your field of expertise. You know, as a user of a similar database, so am I, and I would imagine those of you who are professionals have applied for various things online. I kind of think different folks looking at it might add value. So maybe looking at a last draft kind of thing.
And
what do you think?
I do think, I mean, think about it, the decision of whether or not to do this is something that is within your wheelhouse. It's a council call. That having been said, if I were king for the day, I would say don't pull the trigger on this until you have let the full social worker also
that's true.
visit about this, because this is their baby. And I think just out of comedy and respect, we probably ought to bring them into the discussion. I don't, Ben, Tim, y'all tell me if I'm just completely wrong. I don't think the social work board is going to say no, but we probably ought to hear from them.
When is their next board meeting?
Next Saturday.
Yeah, we've got a Saturday teleconference type meeting.
I don't know if you'll have to put it on the agenda though.
Yeah.
So probably not going to make it on the Saturday meeting.
Yeah, Alice, what do you say?
Hang on, Ben, I think I've got her. She's muted. She called. Hang tight just a second. I'll get her up here.
All right, thank you.
All right, her mic's hot.
Hi, this is Alice.
Good morning, Alice.
Good morning, Ben. Yes, the meeting agenda has already been posted, so I don't think that we can add it. When we met with ASWB a couple of weeks ago, we discussed making sure to add it to the September agenda.
Okay.
And candidly, if we have to do any rule changes, we would, we'd want to get that process started before we really got too far down the road.
And just to make sure I'm remembering correctly, do all of our other professional boards use a system like this for licensing? No. Okay. No, yikes. To me, that just seems like a good business.
Is Tim Spear on this involved today?
Yes, he is.
I have a question for Tim Spear.
Yes, sir.
Hey, Tim.
Hello, sir.
Howdy. Since now we're involving fees and contracts, I have a question, and I do value your experience and expertise. How would you address a concern regarding the potential of or the appearance of conflict of interest between ASWB and the State Board of Social Workers, and now BHEC? How would you address a concern regarding that?
I would need to know what the conflict of interest was. Basically, what we're talking about here, they are already the provider of our exam. And so what they are basically doing is taking over the vetting of whether or not somebody can sit for their exam. They wouldn't be doing anything more really than that. And this already occurs with the licensed professional counselors. So the licensed professional counselors don't have to come to my unit and request to be made eligible to take the licensed professional counselor exam. They go through the exam administrator, the NBCC. And so this would be just a similar situation to that. So I don't see it as a conflict of interest, but I may be looking at it from the wrong lens. And if I'm not answering your question, I'm sorry. I'd be happy to try and expound.
Mr. Morris, is there something that gives you cause to doubt?
Well, as a public member, I'm looking out hopefully for the public interest. And I would be concerned if there were, say, a vote were involved and somebody was in position to vote on something that could create a conflict of interest if they were in a position of power or leadership in both boards.
In both votes.
Well, I guess recusal could occur.
Okay, that needs to be addressed, and we can address that at our social worker board meeting. But
Okay.
That's a very valid point there. Thank you for that, Darrell.
Mr. Morris, I would also add that the very structure of BHEC is designed to guard against anti-competitive misuse, if you will. And it also, in this instance, it also happens to work to guard against any conflict. And here's what I mean. There are 5 of you public members that sit on this council. You guys outnumber the professionals. You could control the discussion and narrative here if you wanted to. And as a result of that, even if you have a professional member that is sitting on both social work and ASWB, that individual is not in a position where they can control this council. The public members here outweigh the professionals. So you guys have the ultimate trump card in this council. It's designed to guard against that very type of things.
Absolutely. You bet. Thank you.
So why don't we, this is Tim Brown, why don't we go ahead and bring the situation out in the public so that there's no appearance of hiding anything. As y'all may be aware or not aware, I have been on the board of directors for ASWB, and I am in my last year of the 4-year term for the presidency. I'm the past president. I did bring this up previously to the social work board in the past and made a suggestion of this being used because of the long-term problem with getting our applications processed, but did not make it an issue. I believe I've told several of the members on this board that I'm part of ASWB, and certainly if you look at our behavioral Health Executive Council website, you'll see it states clearly under my bio that I am part of ASWB. And I think I've been very cautious with my discussion during this meeting today and not trying to sway anyone in any particular direction for voting if there is a vote on this today. So I just want to put that out there so there's no cryptic message, but it's very clear and transparent.
Thank you, Tim. That's wonderful. I
appreciate you, Chair Brown.
Tim, is the social work board, they're a member of ASWB, is that correct?
That's correct.
Okay, and that is an association that's made up of all the social work boards in probably the US and Canada?
Yes, all of North America.
Okay, so that association is designed to be responsive to its membership and their directives and whims, if you will, correct?
That's correct.
Okay. So it's kind of built in to ASWB that the Texas Social Work Board should have some say in, I guess, the direction, its business models and business practices. I mean, that's something that the board of directors, which is made up of board members and folks who serve on the various social work boards throughout the country, the ASWB, their board of directors is made up of these individuals, right?
Correct.
Almost like a membership-based organization.
Yeah. Okay.
Any other concerns? Are there any concerns from our board members regarding what Mr. Brown has disclosed? I, for one, have none, but does anyone else? Sarah? Thank you.
Mr. Brown, this is G4. I thank you for your transparency and your openness in your statement. So I appreciate that. Thank you.
Thank
Well, I would just like to take the chance before we move, if Chair Conseco would allow me just a few minutes. I would like to thank the council and the council members for moving, or at least looking at the concern of the backlog of the social work applications. I also want to thank Tim Spear and Mr. Spinks and Alice and all of the staff over there, you know, from less than a month, decreasing the backlog looks like almost 56%. That's very appreciative on my part, and I know the social workers in the state of Texas. Again, I want to, and I've had very frank discussions with Daryl about this and with Tim Spear about this, that I don't want there to be, that there's any pressure from my part to go the ASWB way. I just know that it is a product that's available and other states have used it successfully, and I didn't see any other good alternatives without increasing FTEs, which again, we don't have a lot of money to do that. But I do want to thank this work toward this issue to take care of this problem.
Thank you, Tim. We do
Mr.
really
Brown?
appreciate it. And I also want to point out that public members are here to make sure that we are abiding by the anti-competitive spirit of the establishment of this council. Our professional members are also asked, because of their professional expertise, their content expertise, you know, we're lucky to have folks who put a great deal of thought into how this council would be constructed. And Tim, honestly, you were so quiet. I didn't think you were on at the beginning. So thank you all so much. Is there anything else, or are we ready to the next item?
I wanted to say thank you to Tim and Daryl for bringing this to the table. The alternative, like Tim just mentioned there, is continuing to throw warm bodies at a problem. And so when we're looking at it in terms of process, this is a different way to handle that. You know, that the expense does not come back on BHEC. It doesn't go back to the social work board. And as someone who is also serves on the Association of Boards, I don't think that there's a conflict of interest here. You know, that's just the way that the system is set up. But I appreciate Tim Brown's willingness to be transparent and open about it, but also to bring us the idea. It's a resource. It's something that's available for us to use if we choose to go in that direction. So thank you, Tim and Daryl, for working on this.
Madam Chair?
Yes.
If you wouldn't mind, I would ask Mr. Spinks, I would be remiss in my fiduciary responsibilities to ask what the competing products are to this, and will you bring any to us that we may see something that's a competitor, so we have just something to compare against?
Yeah.
I would be remiss if I didn't ask that question.
I started to say, I certainly will. I'll look to see what else is out there. I know one other product that is out there is ASPPB, which is the Association of State and Provincial Psychology Boards. They have something called a plus system, and I referenced it in that plan that you guys have there. Plus is very similar to what you saw here today. ASWB is geared specifically towards social work. That's what they know. That's what they do. The problem with going with like an ASPPB plus system is they're geared towards psychology and behavior analysts. So it would take a little bit, a lot more gearing up for them to take it on. But that's the closest thing to this ASWB portal that I have seen so far. I'll do some more looking to see if there's anything else out there. Back with you. I'll bring mine back along with those numbers you'd asked for.
And when do we make a decision on this particular product? Are we listening to the presentation now and making a decision down the road?
I think what I would like to have is some general idea from the council of, we like this, we want to continue, we want to press forward with an idea of making it happen, unless Or if y'all don't like it and just say, forget it, Daryl, we don't like this. I need to know that so I don't waste any more time. Because I don't have time to waste right now, guys. I'm not trying to.
I think it's a good idea, but like you mentioned, it's always good to compare what else is out there, compare the cost and look at the pros and cons about it, because we don't know where this pandemic is going to go and what's going to happen. So to have somebody there already who's done it for several states, and it doesn't really cost us anything, doesn't cost the board anything. And if the results are great, I think we should move forward.
The only thing, my only reservation is engaging in a long-term contract. If we could do something like a 1 year and then knock it out of the park, I think it's going to be easy to renew. But with all the state of flux, with so many moving parts right now, with standing up an agency, I'm not in favor of doing much longer than that. But it's something, shorter term, I could get behind that.
Oh my gosh, I can't believe. John, this has to be the first time you and I have agreed. I want to go out and buy a cake tonight. So, I would agree, though, that 3 years is a non-starter for me. I was going to say 18 months. I'm going to defer to my peer with a year. I'm good with that. Excellent comment, John. Thank you for that.
You're very welcome.
I have a question. Also, let me just say, George, that I think you agreed one other time, but it might have been a dream of ours that there was an agreement before. I'm not sure. I would ask, because Mr. Brown has been so transparent, does he know what other kinds of software are out there that are the competitors for what was presented today?
I do not.
Okay. The other thing, I don't want to lose an idea that came out a little bit earlier. I think it's really important that on the BHEC website, maybe even the board websites, that we say that this is something we're in the process of doing to get people used to it. I think all of us would agree that prior to this pandemic, we had a lot of people that were very resistant to online things, even criminal background checks or fingerprinting. I mean, we saw some resistance, and it was maybe a population that didn't grow up with electronics as much, who was more resistant. And I think we need to be prepared that even with the pandemic, that we at least need to start somewhat grooming people to understand we're going in this direction, be prepared for it, so that they know that we are being attentive to the needs of the population, that we're ahead of the game, being able to do this, that we're learning that this is a more efficient way to do things, which is what our task is. So I don't want that idea to get lost, that we at least announce that or at least make sure we're transparent that this is a process we're in and this is where we're going. And I think people will embrace it in a very positive way.
Thank you, Susan. We're looking forward 5 years down the path. I'd love to see one unified kind of program like this, where in any discipline we could apply electronically. Things would move very quickly. But that's 5 years, Daryl, don't panic.
I love my blood pressure medication.
Okay. I'll look in your desk in just 1 second. And I think we have some consensus. We're going to wait potentially for looking into another product and then bring this forward again at the next meeting. Is that correct? Do you need a motion for that, or is that the consensus of this board, of the council? I always say board, sorry, of the council.
I have a question. I know that we just heard that there's a board meeting this Saturday for the social work board. When is their board meeting after that? And looking at it, when our next, I would like to have had the social work board talk about it and be able to chime in. So what's the timing of those meetings?
So, Alice, is it September the 11th? Is that y'all's next one?
Yes, September 11th.
Chair Brown, do you think, I'm thinking it would be best to take it to your board first and let's make sure they're all okay. I mean, do you think I'm wrong in my thinking there? We not need to do that, or what are your thoughts?
No, my thought is there's no reason not to have them consider it. And since it does affect the social work board, I think buy-in and understanding on their part would be very advantageous in this situation.
Okay. I would say then we'll put it on, we can bring this agenda item back for the first council meeting after the September 11th social work board meeting. Because the next council meeting is the 28th of August. So we won't have anything back by then.
I would like to add, to Steve Christopherson, that what the product that we saw today, I like it. I think it's great, and I think it's a front runner. I don't see Tim being a problem with any of that. I do say we need to be expedient because remember sunset and backlog was not a good word. So we want to get on that. We want to get them all caught up. And I realize that staff is doing a whole lot of work to help with that. And so maybe they can, help us get to a place where we can make a decision. But just for the record, I did like what I saw today in terms of the product. Thank you.
Thank you. Okay, so we'll hear about this in September. First meeting after August 28th.
The first meeting after September the 11th.
After September the 11th.
Yeah.
Okay, then I think we're ready to move forward to number 6, the exceptional items in the LAR. Ooh, I used an acronym. Aren't you impressed?
And just so, an FYI, I'm assuming that y'all are all okay with me publishing this report as well on the website. I'll make some changes about kind of beef up the language about moving people for the expectation that this change is coming. I'll make some changes there, get the chair to approve that. But otherwise, if everybody's okay, I'll go ahead and post this on the website like we originally kind of planned. As far as the LAR issue goes, I wanted to bring this to y'all's attention because normally we would already have our LAR instructions out by now. We would already know kind of what the rules of the game are for the budget. We don't have that now, so I wanted to take this opportunity to tell you what I intend to ask for in terms of an exceptional item in our LAR. First and foremost, any kind of budget cuts that we're required to make in our baseline funding, I intend to ask for that back in an exceptional item. We were designed to address all the problems that all the agencies had. We developed our budget in a manner to address that problem, and to then have it cut is kind of like jerking the rug out from underneath us whenever we just stand up. So I want to make sure we fight to get anything back. Now, we may not be successful, but at least they'll know they've been in a fight after we get done asking for it. So I think we need to do that as that needs to be our primary mission in the LAR, is make sure we ask for any funding that is required to be cut of us in our baseline funding. Number 2, I want to ask for, we currently have a temporary administrative assistant position for 1 year, I believe, in 2021. And I would like for that position to be made permanent. So we've already got the funding for this individual for 1 year, but I would like to have that individual made permanent so that we can address just the myriad number of phone calls, emails, help with the in-office management of the in-office stuff. Number 3, really 3 and 4, my items 3 and 4 are, we're going to need to ask for money for office furniture and for any kind of cabling and IT setup that's going to be needed over at the Bush building. When that building is complete, TFC is going to provide us with the cubicles and the type of desk that you see here out in the open space areas. TFC is not going to purchase desks for like the attorney's office, my office, all the managers, anything in an office they will not purchase the furniture for. They're not going to purchase the chairs that go with the cubicles. So we're going to need to ask for money in our LAR for that, or otherwise we won't have any furniture. Now, we got lucky in that the accountancy board and architecture board are leaving a lot of their furniture here, so we're not going to have to buy furniture when we move here. But, weird, but it's probably cheaper to buy new furniture than it is to move it over there. TFC is going to try to get us a deal on moving, so to some extent we can We can take some stuff like our chairs. We might not have to buy that many chairs over there, but I don't really want to move a lot of the cubicle and this, I forget what, modular furniture is what I'm trying to say, this modular furniture. Our stuff here at the site board is old. The electrical wiring in it is, some of it is just not safe anymore. We got exposed wires. I don't want to take this junk with me wherever I go. This stuff is 20-something years old. It's done its bit for king and country. So those are the things that I'm going to be asking for in the LAR, unless y'all just say, no, don't do that. I don't like that. And then if there's anything else that y'all want to ask for, now is the time. I need to know it so that I can make sure I put that in the LAR. Exceptional items, when I say an exceptional item, I'm talking about you're asking for money that is not in our current budget to do a new project, if you will, new IT purchase, that type of thing. So with that, I'm done. Y'all tell me what you think. Do you see any problems with what I've stated? You want to add anything to that list?
I think if you get anything from architecture, it'll be good looking.
It should be.
I have a question, Daryl, is in terms of video cameras, audio, things to be able to do what we're doing now, do you all have what you need to be able to function well?
I'm trying to buy that stuff now out of BHEC's setup budget. I want to try to get that done this biennium because I don't want to have to go ask the legislature for it. I am going to ask when TFC actually builds the interior of our new office space, I'm going to try to have it set up for video conferencing. I don't yet know if they're going to make us pay for the cabling in the walls, the wiring in the walls, because I want televisions up high when y'all are in the board meeting room. Or you're doing ISCs, I want y'all to be able to, people webcast in and that kind of stuff. I don't yet know what TFC is going to pay for. I think they'll pay for what's in the wall, and I want it done now because I don't want a bunch of ugly cables running down the wall after the fact. We would have to pay for that if I fool around and don't ask for it now. So I'm trying to do that now, Dr. Fletcher. I'm trying to get as much as I can now.
Okay, because I know that would be very helpful just in terms of efficiency and the functioning. And I know for the psychology board, we've been wondering why there hasn't been better technology.
Yeah.
And now that we've experienced what we've experienced as council members, we probably want it even more now because we're spoiled. So I want to make sure there's a need that needs being met so that it will create more efficiency. And I think too, with inventory and labor and all of that, that it takes a bit of time. There's a lot of, like, I know I've had a camera because I'll do media interviews from my office or from my home. And so I invested in a camera that worked really well, but nobody can buy that camera now because everybody's out of stock. So I just want to make mention of that because I do think that that'll be important.
Yeah, and that, like right now we're doing this on a little old Microsoft Live Cam in my office, but I've told staff I want a really good camera set up and microphone set up in the board meetings so that even if y'all want to come back and start doing in-person meetings, we can still broadcast this stuff out. I don't really want to spend the money to have a camera pointed at each of y'all because I don't want to have to hire somebody to manage that. I don't want that fancy of a setup. I don't want to get crazy stupid, but at the same time, I want folks to be able to see kind of a fisheye view, if you will, of the boardroom and be able to hear all of you at the very least. I think that's the way we need to go. So that's kind of what I'm working towards now, seeing if I can get the new boardroom set up that way.
Just to piggyback on that, I just want to echo, I support anything within reason that makes us and our meetings more accessible to the public. Daryl, I agree with you. We could go way overboard with remote cameras and, pan and zoom and somebody to operate it. And I agree that's not necessary. But for somebody who is not able to come to Austin to see what we're doing, I think that's a good thing. And I support it. And I appreciate the comments so far on this.
Thank you. Anybody else? Daryl, is there anything else before we move on to public comments?
No, ma'am.
And how do we manage that on Zoom?
I'll come over here.
Okay. you want to trade places with me?
No, I
Okay.
can do it right here.
He's next to me. If we don't have the fisheye yet.
Okay, well, we know Alice doesn't have any public comments, and we know Chair Brown doesn't. Mr. Fernandez is one of my staff, so I don't think he's going to have public comment. Let's see, whoever CD is. CD, do you have any public comments you'd like to give? Okay. Okay, I guess they're not going to. All right, this is Mr. Smith from the governor's office. Do you have any public comments?
Chris Smith, are you there?
Okay. And then where did Sarah Fass? Oh, she hung up. Okay.
Want to try CD one more time? CD, are you there?
Okay. No public comments. Okay. That's it.
It sounds like that's it. There are no public comments. I'd like to thank all of you for participating, for taking so much of your day. Mr. Morris, we look forward to meeting you in person. And in the meantime, I hope everybody stays not only physically healthy, but mentally healthy. And for goodness sake, we'll all control our behavior. It's our job. Thank you so much for attending. John, I'm going to call you privately because I want to know about those guitars in the background.
No.
Okay.
Bye, everybody. Thank you so much for taking so much time. Daryl, thank you for your
Bye. Take care.
Bye.
Bye.
Stay safe.
Adios.